Hello, how are you today?
I'm good. How are you?
Not too bad. Thank you for coming.
Thank you.
Okay, so today I'm going to ask you three questions. Okay, are you ready for them?
Yep.
Okay, so considering the NMBA standard for practice that govern your nursing practice, how will you deal with the following situation? It is your first rotation as a new graduate nurse in the cardiac unit. You responded to a patient's call. When entering the room, one of your patients was complaining of chest pain, and another confused patient was trying to climb out of the bed. How would you handle this situation? Reflect on how you would handle the stress of this job.
Okay. So one of the standards for registered nurse is to provide comprehensive, safe, and high quality practice to achieve agreed goals and results in response to people's nursing needs. Nurse can also implement various practice based on the professional scope of registered nurse or the clinical or non-clinical roles of others. Nurse also can appropriately delegate to registered nurse and others. So in this situation, I will go to the patient who is trying to climb out of the bed and then put the both sides bed lowers on, and then I'll lower the bed as well. Because I just want to make sure the patient is not, out of the bed. Because if the patient is climbing out of the bed, it can cause some unnecessary injuries, which is I don't want to happen. Then I will handle the patient who was complaining of the chest pain. Because this is a cardiac unit, the patient may suffer cardiac infection. And this is a serious event and I need to deal with right now. And at the same time, I will also ask for help from other staff to help me with the confused patient. I will see who is on the floor, who is on the ward, and who is not busy, or any nursing staff or any manager, just to monitor the patient who was trying to come out of bed. And now I'll do the ECG for the patient who was complaining the chest pain. And I will check the medication chart if the doctor have prescribed some medication for the patient's chest pain. And then I will also open all curtains to make sure I can see everyone on the ward. Because I'm not only look after 2 patients, I usually have 4 patients. And then it is my responsibility to look after my patients, but I will always remember that I'm not working alone. I'm working as a team. If I encounter some situation that I'm not able to deal with at the same time, I will definitely call help from others, like nursing staff or manager. So how do I reflect the stress? So I think hard work should not be confused with overwork at the expense of interpersonal relationships and physical health. I have some strategies to deal with workplace. I think exercise is a good way for me to reduce stress level. I love to go for a run because it can release my stress level, and also I can breathe some fresh air. Any form of physical activity is beneficial, like reading a novel or watching a concert, or even playing games with my family members, or any activities that may myself happy. I'll also make sure I'm getting enough quality sleep, because it's essential for myself to manage the stress. I will also establish the healthy sleep habits, like by limiting caffeine intake later in the day and reducing nightly stimulating activities, such as using a computer and watching a lot of TV. I do believe what happens at work can be reported in the ward to see if anyone can come up with a better solution. Like if I encounter some situation I cannot deal with the same times, I can talk to we can do a debrief later. I can talk to the nursing team, and I can talk to the supervisor, just to make sure we can come up with the better solution. And I think the health and work efficiency of employee is very important, just to make sure that we can come up with an effective plans to manage the stressor I have identified so I can perform at my best. Although some parts of the plan may be designed to help you improve your my skills in some particular area, such as time management, but other elements may include identifying employers' sponsor health resource I can use. Like I can gain some necessary resource to support myself. And then I also can get some support from the college.
Okay.
Yeah.
Ready for question 2?
Yeah.
Okay. So nurses have to comply with occupational health and safety standard. Describe a time you had to deal with an unsafe situation and what action did you take?
Okay. So I must comply with occupational health and safety standards to resolve incidents that occurred in the nursing home where I work as an AAN. When the incident involved me working in the nursing home, I have a woman who was very difficult to deal with. She not only refused the medication given by the registered nurse, but she also threw glasses and other things on the table. So what I did is I immediately swapped the glass on the floor just to make sure the patient would not get hurt by the broken glasses. Then I give her some space, and I'll slowly explain to the patient the importance of taking medications. And I'll also provide her a cup of tea and some biscuits. And I also sat next to her. And by spending time with the patient, I effectively established a therapeutic relationship with her. And gradually, the patient settled down and began to cooperate with me. I still remember that to say thank you. You are very good and warm nurse. And I still remember this sentence because this sentence inspired me a lot. Even just a simple, word, thank you. Yeah, but it sounds like I did a right thing, good thing for me and for her. And then in addition, I also have some experience in the surgical ward where I work as a student nurse. Patient A is my patient. She has a respiratory disease that can be transmitted through the air. And patient's parents came to visit her, but they don't know what's going on with the patient A. Okay, that time call we haven't started. Like they still allow the visitor to come into the patient to the ward to visit the family or friends. So according to the occupational health and safety standards, registered nurse needs to make sure illness is not transmitted to other people. So I walked in front of the family members, and then I explained to the patient's age condition carefully to her parents, and then educate them to put the PPE on just to make sure they will not get the disease from their family members. Then the patient's parents they're very cooperating, and they put the mask on, and then the PPE on. Yeah, and this promotes me that I can explain to the patient's family's member by showing respect and understanding, thereby reducing the possibility of the patient transmission to the family members.
Okay. Ready for question 3?
Yeah.
So the completion of your bachelor degree is only the foundation of your development. As a professional nurse, ahead of you, there is a lifelong of learning and autonomy. After obtaining employment, what is your short term within the next 6 months to 1 year and long term within the 2 to 5 years career plan or commitment to professional development?
Yeah. From my understanding, nurse needs lifelong learning and autonomy. So my short-term goal is to learn more clinical skills and gain more experience, become more familiar with the ward, and the medication, and also establish professional relationship with the team in the next 6 months. As the registered nurse, I must comply with the scope of my practice and a New South Wales health policy directives. And this includes infection control, which has helped me to provide safe care while minimizing the risk of infection disease such as MRSA and MLO. Also, simple measures such as PPE and do a proper hand hygiene. Just make sure I will not transmit the disease through patients to different patients. Yeah, and also I will do, when I finish the injection, I will put the needle in the right sharp vein. And then I think continuing improvement can improve patient safety and clinical quality, and just to prevent some adverse events. And then I will also make sure, if I don't know if I'm not 100% sure, I will ask the college or ask the manager or the, just to make sure, something is, just to make sure I got the right answer. Mm-hmm. And then I will always, when I give the medication, and I will always check the means, just to make sure I give the right medication, right dose, right time, right patient, right route. Mm-hmm. And also, when I give the medication injection to the patient, I will check the Australia injection as well, just to when any side effects or any dosage that I have to be careful. I will never rush to give any medication or injection. Yeah, and then I will and then I will always follow Australian health standards and quality council, just to make sure I'm giving the safe care. I will also continue to update and understand the health policy of New South Wales and strictly follow their requirements. So my long-term goal is that no matter how many years of experience I have, I still need to learn, because nursing is a constantly changing profession. So I will not stop learning. I will continue to learn. I want to be a good nurse. And then I will also require myself to develop my best practice and comply with the current standards, code of conduct, and all other professional standards set by the Australian Council of Nurses and Midwives. I also think best practice must also include strict adherence and updating my knowledge of current hospital policies and procedures, education, and my own learning interests in my chosen field of care through continuous professional development and records.
That all?
No, I still have something to add. So in 5 years, I see myself here as hospital, contributing to the team and adding value for the branch. And I want to grow with the hospital. And I also plan to apply for the master course in 5 years to continue my nursing knowledge and hope that I will become a nurse practitioner in the future.
Good. That's all?
Yeah.
Thank you so much. Thank you for taking your time to answer all these questions. Really appreciate it.
Thank you. Thank you for taking time to interview me. Bye-bye.
Bye.